Hey guys, Dr. Fire here. So, like on the previous video, we saw a lot of things about the septum disease's etiology and we know how it looks like. So, if you have missed that video, you have to stop this video right now and go back and see that video. So we'll see the clinical features. It's a continuation of the previous video, okay? Deviated nasal septum. 1 in 5 people have DNS. There's like 5 types of DNS. First one's anterior dislocation, C-shaped deformity, S-shaped deformity, spur, and thickening of the nasal septum. Okay, there are like clinical features could be remembered by the mnemonic high Nassim. Nassim is not my friend or anything, but yeah, it's a good mnemonic. High is H. H stands for headache. So like a person with DNS has headache. Nassim, N for nasal obstruction, A for anosmia, S is sinusitis, E epistaxis, E external deformity, M is medial ear infection. I'll explain you why you get every clinical feature of it by a picture. So here there's like person's got a deviated nasal septum. So this person persistently has headache because here one of the sinuses is getting like obscured. So like if the septum is deviated on one side, the ostia is going to be like blocked, so that particular sinus is going to be there. We are talking about frontal sinus, which drains into the middle meatus. So like if the middle meatus is going to be blocked, that side frontal sinus is not going to drain down, so that is going to cause a frontal sinusitis that can lead to headache, right? So in Nassim, S is sinusitis. So like the sinusitis is the main thing which causes headache. But sometimes there's this fourth type of DNS, which is called the septal spur. Well, that spur can impinge on the side of the nose, and that causes like another cause of headache because it's kind of like the same nerve supply everywhere, right? That's why. And then N for nasal obstruction. See over here, it's like one side is completely obstructing the nose. That causes nasal obstruction. A is like anosmia. So because there's nasal obstruction, the smell is just not entering inside of the nose. So that's going to cause like loss in the smell sensation, that is anosmia. S is sinusitis. E is epistaxis. So like this particular nasal spur sometimes can impinge on the blood vessels, and so that is going to cause bleeding, so that is causing epistaxis. And as such, it's very obvious. Another E is external deformity. So like if you're looking at the person, the first thing you can notice on them is external deformity. And last but not the least, in Nassim, you've got the middle ear infection. Due to obvious reasons, ENT is a linked subject. So like a problem with the nose will have manifestation in the ear, will have manifestation in the throat as well. Middle ear infection specifically happening in DNS is because of blockage of the eustachian tube, because of like a lot of secretions, because of exaggerated DNS, that is going to cause like blockage of the eustachian tube. So eustachian tube is blocked means it's kind of like a cause why there's no aeration. No aeration means secretions are going to build up. Secretions build up means there is infection, right? We'll see what happens in a septal hematoma. So you're just like looking at a septal hematoma right now. This is a septal hematoma. So like when you're looking at this picture, you can see that the right and left side, the nostrils are going to be blocked, and if they're blocked, or obviously there's going to be a nasal obstruction. Another thing is the cause of nasal septal hematoma. So like that is trauma, right? So obviously there's going to be a lot of pain. Third is sometimes this hematoma can rupture, and that's going to cause like a torrential bleed, but obviously that's not like the main clinical feature. You can see bilateral nasal obstruction, frontal headache, pressure sensation over the nasal bridge. On inspection, we already saw rounded swellings in either side of the septum. Palpation will show a soft and fluctuant swelling. Septal abscess, almost the same thing, except that there is a lot of pain and a lot of tenderness along with fever and chills. Skin over the nose is red and swollen, and inspection is same as hematoma, except that there is more tenderness and there's like smooth rounded swelling on either side of the septum. Palpation is soft and fluctuant. The only difference, there are three differences between septal hematoma and septal abscess. Inspection is going to be the same, okay? Soft and fluctuant swelling. No, it's like rounded swelling on either side of the septum. The one main difference is clinically, there's going to be a lot of pain in the abscess, number one. Second is systemic signs will be there, fever, chills. Third is there's going to be submandibular lymph node enlargement. All right, yeah. And then nasal septum perforation, so it can be a small hole or a large hole. If it is a small hole, whenever the person is going to like inhale and exhale, there's going to be a whistling sound. So like, okay, so that is nasal septum perforation. And then if it's a large hole, there's crust formation, which causes nasal obstruction. Crust may peel off, leading to epistaxis. Okay, so that's like a large crust formation. Fracture is like pain, swelling, deformity, and history of trauma. Okay, all these will be there in case of fracture. Clinical feature, fracture, I mean, like, yeah, the person will obviously complain of pain and swelling. And there's a history of trauma. And then we'll see the treatment. So, like, once again, we'll see the pictures of the diseases. So, this is like the teenage boy who got into a fight. So, this is his possibly he had epistaxis. That's just why we put a chalk piece inside of his nose, and there's like obvious swelling here, little bit of redness here. Obviously he's in pain, and then there's a deformity which is seen. There's like deformity in the DNS. Obviously the treatment is going to be like correction of the deformity. You will be able to like come up with treatment yourself. You just need to learn a little bit extra, but yeah, most of the stuff we already know. We just have to write it in paper and we easily pass. We have to write the same thing in the prescription, and the patient is gonna get yours. It's as simple as that. Medicine is not very hard, okay guys? You just need the particular confidence that medicine is not very hard. It's just like the professors don't teach us really well. Okay, and this is like a septal hematoma. Obviously if there's a blood clot, either it's going to like resolve on itself or it's very big, you're going to like drain the hematoma. But if it's an abscess, obviously you have to like take it out. Whenever there's a pus, you have to remove it. That is like the golden rule of medicine. And this is like septal perforation. So like there's a hole, you have to close up the hole. So for that we use some stylistic button. So like it just like fits inside of it. We see the treatment in detail. So deviated nasal septum correction surgery is called septoplasty or SMR, submucosal resection. And then septal hematoma is obviously like if there's a blood clot, you have to do aspiration, incision and drainage, and like systemic antibiotics. Septal abscess, yeah, the golden rule is wherever there's an abscess, you have to remove it immediately. So drainage ASAP as soon as possible, incision and suction. So we're doing suction in abscess because we don't want to leave behind any little part of the, we don't want to leave even a small part of the abscess inside patient. Okay, and then systemic antibiotics are given for at least 2 weeks. And the nasal septum perforation, identify the cause of perforation by biopsy. We have like a good number of causes. Obviously it starts from nose picking. It's like T-dip, right? T for trauma. I is idiopathic. D is some drugs like cocaine. P is like pathological because of infection, myiasis, hematoma, abscess and all. So like treat the cause, and then to close up the hole you have to use a plastic flap or use a stylistic button. And you can Google the stylistic button. It actually looks like a button. Okay, you can Google it right now. Keep the nose crust free by alkaline douche and a bland ointment. And then fracture. For a fracture, it's very important to get a history from the patient, history of trauma. And obviously immediately after that, you have to like recognize it. There's going to be like epistaxis, which is why you have to like, the person had already applied this nasal pack to stop him from bleeding. So like you have to take care of it. And then the fractured septal fragments are like repositioned, and you have to like support it so that it does not go away. Okay, so like reposition and support it. And then mattress suture is done. Nasal packing is used so that there's no more bleeding. And that's how we treat a nasal fracture. So I hope you like this video because I made it in a very concise way. But obviously if you don't like this video, you can comment it in the comments below. Even if you like it, you can comment it in the comments below. Do not hesitate to comment down any doubts you have. Okay, thank you. Spread the news of a good YouTube channel to everyone. It's Dr. Fire again. Thank you guys. Stay smart. Bye bye.